If you give more activity, it directly correlates with more radiation dose. Any one PET scan is not going to harm a patient. We're talking about a patient who's going through a journey of multiple PET scans, multiple radiation CT images. That becomes cumulative. My name's Umesh Oza. I'm a radiologist with nuclear medicine subspecialty training, and I've been in practice over 20 years. What is an isotope? An atom has protons, neutrons, and electrons. We're going to take electrons off the table. Carbon has 6 protons and 6 neutrons. That's carbon-12. If you add a neutron, that becomes an isotope of carbon. It's still carbon, now it's 6 plus 7, so that's carbon-13. Gallium-68 is an isotope of gallium, and it's also radioactive. So it's an unstable atom that wants to become stable and will give off energy. When a radioisotope is unstable, it gives off a positron, and that energy leaves the isotope and travels a short distance and hits an electron. When an electron is annihilated, it shoots off 2 511 keV photons in exact opposite direction. That's the magical number detected by a PET system. As those events are happening in a body, those are detected in different places, and an image is reconstructed from those data points. When you look at radioisotopes, they're decaying. There's certain isotopes that yield energy that we can use for imaging, and have other things they yield that are not good for imaging. The higher the yield, that means it's decaying more in that perfect range, and you can create images out of it. Fluorine-18 and gallium-68 have very similar yields. Gallium-68 is in the high 80s, fluorine-18 is in the 90s. Copper-64, it's about 17% yield. If you're only getting a few of those very important photons, you have to increase the activity. And if you don't do that, your image times can be increased. But we go from 2 to 3 minutes per bed, which is a total of about 10-minute scan, becomes a 20-minute scan or a 30-minute scan. If you think about the main agents that are approved by the FDA for oncologic imaging, all the uptake that we experience is about 1 hour. You get the patient, you inject the dose, and about an hour later, you're imaging the patient. But with the lower yield, there are papers that show that copper-64 PSMA has greater sensitivity and specificity only at the 24-hour mark. And now you have a patient who comes in, occupies a room where you're going to inject them. They're not only just coming in and not getting a scan, but then you send them away. Then you hope they come back at the correct time. What happens to that patient is they have 2 events coming into the imaging center. Copper-64 has the longest half-life of those 3, and it's 12.7 hours. Fluorine-18 is about 110 minutes, and gallium-68 conveniently is about 68 minutes. If you have a short half-life agent, every half-life, half of that product you created goes away, just disappears. So you physically have to be next to where you produced it, and those are produced at a cyclotron. You got to be in a big city and near academic centers. In the ideal range, you can still deliver it, but you have to deliver a very high activity. That activity is calibrated for a certain time. There's not a lot of leeway. Gallium-68 has about a 68-minute half-life. That seems short, but it's very flexible because of its production. It's made by a generator. A generator can be parked in a radiopharmacy in a small town, and you can elute, add it to the PSMA and inject it to the patient. That means if our patients who are sick, they're old, or they're just generally slow, gallium-68's shelf life and ability to be given at delayed times or on time wins over those 2 other agents. The production matters. I think the very important thing a clinician should think about is don't take one data point. Sensitivity, specificity, production, half-life, positron yield, positron range, all those things are important. If you just take one thing and someone tells you this isotope has the best this, you're going to choose the wrong isotope. Step back, look at the characteristics of all the isotopes, and come up with a decision for your patient, for your practice. And for my practice, that would be gallium-68.